Today we're meeting with Dr. Masri. Now, Dr. Masri is a board-certified plastic surgeon who has been practicing medicine in South Florida for almost 20 years. His surgical skills are derived from his comprehensive training in both general and plastic surgery. He has a rare distinction of holding dual certifications from both the American Board of Plastic Surgery and the American Board of Surgery. He is also a fellow of the American College of Surgeons. Dr. Masri, thank you very much for joining us on the program today.
Thank you very much for having me.
Well, we're going to talk today about breast reduction and more in general, the general common practices of breast reduction. First of all, I'm sure our audience has some questions about your history, and let's start with, how many breast reductions do you typically do in a week, and how many have you done over your career?
I would say that breast reduction procedure is something that it's probably one of the most popular procedures of our practice. Over the years, I've had extensive experience with breast reduction, extending from my residency on to now in my professional practice. I would say in a regular week, we could probably do 4 breast reductions pretty easily. But for the most part, I would say the range of breast reductions really, it just depends on everything from the time of the year to what's coming in the door. But most cases, it's about anywhere from 25 to 100 breast reductions a year, and over my experience, I've probably done over 1,000.
And Dr. Masri, who would be a typical candidate for breast reduction, and what makes somebody a good candidate for that? And obviously, are there some people that just it wouldn't work for? Maybe you could elaborate on that as well.
Most people who present for breast reductions are people who are usually symptomatic. Large breasts can create a lot of discomfort and pain, typically around the shoulders, around the neck. It's also responsible for a lot of irritation underneath the skin on the lower parts of the breast. The requirement to wear very constricting, tight bras is also a problem with women with large breasts. So by and large, most women who present with complaints of large breasts have other associated symptoms. And in most cases, it's not all just a cosmetic consideration. It's more of a functional consideration.
And what's the recovery like?
Recovery from breast reduction surgery is, I think, relatively straightforward. Most women experience a little discomfort immediately post-operatively, but the recovery is in most cases about a week.
And what's the general goal of breast reduction? What are you trying to accomplish? And I should also mention a common question that comes in is, would a bra still be required immediately or even long term?
I think the goal of breast reduction surgery is to alleviate some of the symptomatology related to large breasts. In the breast reduction procedure, we remove skin and breast tissue to decrease the volume of the breast. And by decreasing the volume of the breast, we're also able to improve the shape of the breast and improve the location and the relationship of the nipple areolar complex to the relationship of that to the breast itself. Now, by doing this procedure, we effectively lift the breast. So we lift the breast, we're improving shape of the breast, and we're also improving the projection of the breast. So these are all the goals of the procedure that really bras are used to emulate. Bras are used to create all of those characteristics of a breast. So having the breast reduction procedure doesn't necessarily mean that you can go without a bra, but I think that in most cases, the supportive features necessary or that bras are used for are and somewhat eliminated from having a breast reduction. Now, a lot of variables are necessary to decide whether or not you still need a bra or you would still need to wear a bra after a reduction. And I think that's primarily just a matter of personal preference. Mm-hmm. And it's also related to a lot of the amount of breast tissue that's been removed, the size reduction essentially related to the procedure.
So Dr. Masri, do you have to do this in a hospital, or where do you perform this surgery?
It really depends. A lot of factors are considered. Your overall medical condition is a very important consideration. There are breast reductions that can be done or performed in an office setting without a problem. However, most people who present with for breast reduction surgery really, in my opinion, require a hospital setting, only in the sense that it has to be done under general anesthesia. In doing so, general anesthesia, some people postoperatively have problems related to nausea, vomiting. They may have some discomfort that's just not alleviated with simple oral medications, may require some IV medication. So in some cases, again, we take this on a case-by-case basis. People may require overnight hospitalization, but most of our procedures are done in the hospital. I think that there's a certain safety index related to having procedures performed in the hospital. Typically procedures that require removing large amounts of tissue and that may or may not be uncomfortable postoperatively.
And so now that we're in a hospital, what about covering the cost? I mean, will insurance cover the procedure?
In most cases, breast reduction surgery is covered by insurance. Now, this depends on the insurance companies and the policies related, to this coverage. However, based on the symptomatology of patients presenting for this procedure, insurance companies, there are criteria related to medical necessity, which insurance companies do request. And obviously, people with symptoms related to large pendulous breasts do qualify as medical necessity. The authorization process is something that we have a lot of experience in, but insurance changes every month. Insurance companies make new decisions, but we work with patients and insurance companies to try to make sure that if your policy does provide coverage for this procedure, that we definitely do it through the insurance.
So Dr. Masri, getting to maybe a little bit more about shape and time. So if there's weight gain or weight loss, what will happen to the shape and size of the breast? Will it actually grow and shrink according to personal shape of the body?
Well, yes, it will. As we age, our breast volume gets replaced, our breast tissue gets replaced with fatty tissue. And that fatty tissue is definitely sensitive to the effects of weight loss and weight gain. So for example, a woman with large breasts in her 40s who has gained a lot of weight will find that weight distribution is probably going to go, to a certain percentage in her breasts. Now, in the same patient with weight loss, she'll probably see a significant weight loss from her breasts as well. That I really believe that it's more of an age-related phenomenon, and certainly the issues related to weight loss and weight gain do play in the cosmesis of a breast reduction postoperatively.
Okay. So what about situations where a patient plans to have children and they want to nurse a baby? What happens after the procedure in a situation like that?
That's a very common question, and the way that I answer that question is more related to the fact that when you're doing this procedure, you're not affecting the ducts on the nipple areolar complex that provide milk to the baby. Now, you're reducing the volume of breast tissue that ultimately leads into those ducts that provide the milk to the baby. But the real issue is that functionally you should be able to breastfeed. However, in some cases, you are unable to produce enough milk to satisfy the baby. There have been studies to show that women overall who have any type of breast procedure, whether it's a reduction, whether it's an augmentation, or whether it's just a breast lift, statistically, and they've done studies on this, just choose not to, for personal reasons, breastfeed. But it doesn't necessarily mean that you can't physiologically breastfeed.
And for the screening purposes of breast cancer, for example, is it more difficult to detect masses after a procedure like this?
The procedure is, in most cases, done on women over the age of 35. Now, certainly there's a younger population who have breast cancer, who have breast reductions. However, for women who are closer to the age of 40, we always request a preoperative screening mammogram. The recommendations, depending on your personal family issues or your personal history of any breast ailments, usually dictates this. But in most cases, we request that you have a screening mammogram if you're around the age of 40, just to have a baseline. Now, if for whatever reason after surgery there's a question of palpable masses or something suspicious on mammogram, there's always a baseline where there's always a reference from that preoperative screening mammogram. Now, just having a breast reduction in and of itself does not mean that there is a possibility of changing the architecture of the breast such that a mass is not detectable by radiographic studies. What it does mean is only that if there is anything suspicious on mammogram, that in this day and age, radiologists and breast surgeons are very aggressive about performing additional studies. But that's whether you had a breast reduction or you had any or nothing done. It's just in this day and age, if there are suspicious findings on a breast exam, that they can be evaluated in a number of different ways, so it shouldn't be a concern.
Oh, that clarifies that point very well. So what about risks? What kinds of things can go wrong, and what are some of the preemptive steps or the preparing steps in order to reduce, let's say, for the risk of infection or what have you? Can you maybe elaborate a bit on that?
Yes, I think those are very important considerations. And that's why preoperatively we really assess your past medical history, your past surgical history. Some complications typically occur with people who are not basically at their peak medical status. I would say that the biggest concerns for me are people who smoke. Smokers run a higher risk of developing wound infections. They run a higher risk of what we call wound dehiscence, where the skin that we brought together opens up a little bit. There's also considerations related to the nipple areolar complex. Smokers have a higher incidence of what we call necrosis, which that nipple areolar complex, the tissue of that nipple areolar complex, which is so dependent on blood supply from some certain elements of the breast tissue, are compromised, and those are big considerations. But in terms of wound healing, we watch for people who are diabetics or poorly controlled diabetics, I might add. Normal diabetes with good control is really not a contraindication to having the surgery. The biggest contraindication, I would say, is smoking, and we really encourage people who come in for evaluation to stop smoking for at least 6 weeks prior to surgery. Otherwise, from the full range of young women requesting breast reduction and surgery to older women just tired of carrying around the weight, we do a careful analysis, and of course we make sure that we are in contact with their primary doctors, their internal medicine doctor, just to make sure that there's nothing that we have to be concerned about, overly concerned about in terms of recovery. Now, aside from issues related to potential infections, there are always risks about, and I wouldn't say that these are risks, but there are always considerations about how well people scar and the areas in which they scar. Sometimes women may tend to develop what we call hypertrophic scarring, which is scarring that's a little spread or more spread than it was following the surgery. And sometimes there are women who are predisposed to what we call keloid scarring, which are very raised and painful and can be painful. These scars are problematic, but there are certain things that we can do to try to prevent, and post-operatively we can try to treat them using different modalities. The one thing that I do want to mention, and this is a question that's very common when young women present to the office, is, does the procedure affect sensation to my nipple areolar complex, and will that be altered? And the answer to that question is straight out yes, maybe. However, that change in sensation usually resolves or comes back to a baseline anywhere from 6 months to a year after surgery, if it happens. I would say in my experience that I've seen that in probably about 10 to 15% of women have a situation where they experience insensate nipples following surgery. But in most cases, that returns. It may not, if it does happen, again, it's a rare occurrence, but if it does happen, it may not return to 100%, but maybe to about 80%.
Got it. So, kind of summing up here, we'll look a little bit at some of the, obviously, the fears that people have. What if this procedure doesn't meet reasonable expectations? And I mean reasonable, I mean, you know, what someone would normally see in a person's inconsistencies in their body, for example. You know, for example, what if one breast is slightly higher or larger than the other? What do you have to say about that?
There are always procedures that we can do to treat issues related to asymmetry post-operatively. In a lot of cases, it's very difficult to gauge how well the tissues are going to readjust to their new positions, how well patients are going to scar following the procedures. But I think more importantly, it really needs to be evaluated, or issues related to potential asymmetry, potential aesthetically displeasing scars. All of those issues are something that we address about 6 months to a year after surgery. But those are definitely issues that can be addressed, and in most cases they can be addressed with very minor revisions. I would say that 85% of situations like that are something that can be done under local anesthesia in the office and really have little to no downtime. The big, I think one of the big concerns is, you know, if I have a procedure and, you know, it's not to my liking, you know, what can be done about it in terms of volume. I find that women who have very large breasts are very eager to have very small breasts, but it's a very important consideration with a woman who's had large breasts for 20 years of her life to all of a sudden wake up one day and not be able to see that she has the same type of volume or breast tissue that she had before. So I think it's very important that we counsel our clients very carefully on what it is that the breast reduction is going to accomplish. Overall, it's very important to understand as well that in all of plastic surgery, every procedure that we do, from facelifts to neck lifts to tummy tucks to liposuction, studies have shown, and these aren't our studies, but these are actual scientific studies that have been published, in all of plastic surgery, breast reduction procedures provide the highest satisfaction ratings to people who have them. And that really goes without saying when you see a woman who's complained so long for having neck pain, back pain, shoulder pain, irritating bra strap injuries, superficial skin infections related to these large pendulous breasts. Those people following breast reduction surgery are very, very happy to get rid of a lot of these problems. And it becomes a situation that it's not only a functional improvement in their lifestyles, but they're always very, very happy with an aesthetic improvement of their breasts and the way that they're able to wear their clothes better and they're able to find clothes that fit. That's a very common phrase that after breast reduction is that, oh, wow, now I can buy clothes that fit. So now I'm going to spend a lot more money than I thought I was initially. So, I think breast reduction surgery, and I've seen it just based on the number of breast reductions I've been involved with over the years, it is the most satisfying and rewarding procedure, not only for myself, but for the patients who have the procedure.
So kind of in summary, is there anything that a patient needs to do or needs to know to prepare for this? And maybe, as a closing comment, maybe offer your suggestions to a would-be patient.
I think preparation for breast reduction isn't something that happens overnight. I think that there's a lot of psychological preparation involved. And again, that relates back to what I mentioned previously about the fact that here you're looking at yourself a certain way, you're buying clothes a certain way, you're buying bras a certain way, and then the next day that's completely changed. Most people who come into the office for a breast reduction procedure trying to find out more information about breast reduction procedures already know from somebody who's had it done before, a relative or a friend who's had it done before. So they kind of know of the experience. I think the important thing in terms of preparation is when you're discussing possible breast reduction with your doctor, you want to make sure that it's something that you're really looking to, I don't want to say looking to improve your life, but you want to make sure that it's something that you've decided that there's no other way to deal with your large breast issue. Now, what do I mean by that? Well, it's certainly, we talked about how weight loss and weight gain affect your breasts. If you're looking to have a breast reduction to lose weight, certainly you are going to lose weight from the procedure. But if you come in with large breasts and you've progressively gained weight over the last 5 years, one of my comments is typically, well, how would your breast look if you lost 10, 20 pounds? Do they look any different? And oftentimes I see somebody who looks at me and says, well, you know what? I don't know. That could be something. So there is no replacement for a good balanced diet and exercise. And if you are in your, I'm not going to say your best health, but if you were in a healthy situation and you still have large symptomatic breasts, then it's definitely something to consider.
Well, Dr. Masri, as always, it's great having you on the show explaining and demystifying a lot of the topics related to cosmetic surgery. Thank you once again for joining us today.
Thank you very much for having me. I appreciate the opportunity.